So thank you all for the opportunity to moderate this session. It is my pleasure to introduce my colleague and a public health medical specialist, Prof. Dr. Victor Ho. His first experience in public health teaching started in 2002 when he taught occupational health to the undergraduate medical students at University Malaya Klang campus on a part-time basis. He joined University Malaya as a full-time lecturer in 2004. He has been using digital tools like websites to assist his students early on in his teaching career. He is an early adopter in technology and has embraced online platforms such as Moodle very, very early on. He continues to explore new tools, methods, and processes to improve and simplify his work. He has developed learning portals for national and regional professional associations. So now I would like to invite Prof. Victor Ho to give his presentation. And for all our participants, if you would like to ask a question and answer, please use the Q&A. Thank you very much. Off to you, Prof. Victor.
Thank you very much, Prof. Sanjay Rampal. I hope that all of you can see my presentation. Good morning, everybody, and welcome. This morning, I'm going to talk about innovation in public health education. Basically, it can be used in any education system. It's just that how we actually evolve and how we have been thinking of adapting to the situation so that we can actually deliver what we promise to deliver to the student, and in a much more engaging and modern method. This is me. Okay, good. So outline of today's lectures, basically we discuss, basically it's a discussion session to just share what we have been doing, and that will basically give you ideas of what you can do in your own practice, and how do you evolve in your own practice. I will start with community posting during lockdown, providing avenue for health communication, online courses, hybrid instruction, gamification in education, and hybrid learning environment. I hope to finish this early so that we can have a long discussion. No worries. All right. So we understand that community posting is one of the requirements under the UMP program and also under the MBBS program, and it has been running since the 1964 when we started the MBBS program in University Malaya. But during lockdown, there was an issue that we still need to continue community posting, and that is where we quickly evolve and come up with how can we do community posting without actually going to the community per se. So the community posting learning objective was understand the principle of disease prevention and improve population health, understand the contribution of family, community, and environmental health, understand the roles and functions of various entities within the healthcare system, relation to community, and determine the health issues in the community, and demonstrate communication and community engagement skills. So the strategies that we have envisioned and planned for is basically to look at it and how can we actually engage the students to actually be understanding, to actually be going to the community in inverted commas, but not really going to the community because due to the lockdown. So we have basically lectures. Basically, that is the normal delivery that we have. We also have case-based learning. We started with 4 case-based learning before the lockdown. We have public health communication, community project, MOOC courses, and interview session with representative from district. So during the lockdown, basically we changed it to we increased the case-based learning from 4 to 14, and we included public health communication as one of the venue for them to communicate. But we provide the avenue for the public health communication, and also we teach them to communicate not just through our own portal but also to write to newspaper. So community project, we ask them to discuss with the district health office to look at from situation analysis perspective, and of course we identify MOOC courses that are good in the context that this is not the MOOC that we have, but this is the MOOC that's available online for them to understand the principle of public health and also community engagement. And the last basically is what they need to do anyway, but instead of doing it as a face-to-face session, we arrange an online interview session with representative of the district health office for them to basically interview them and understand them. So what we are going to talk about is basically what I'm going to highlight is the case-based learning that basically we have created. From 4 case-based learning, we have expanded to 12 case-based learning, which is basically to what we call to develop or to provide a cases that is based on the community and based on what they actually would be seeing in the community. So this is based on the experience that we have during the other community posting that we have, and that is where we decided to come up with 12 case-based learning. So looking at community engagement in public health, sustainable environment development, occupational health study, social determinants of adolescent and maternal health, nutrition, the story of Kam Agong, family health, non-communicable disease, HIV/AIDS, poverty and health, and occupational health risk management. So all these case studies are done during the community posting, and that basically engage them in communication and discussion of the case itself. I'm going to share with you just one case that we have. Basically, this is the environmental health case when we have trigger 1 and trigger 2 and trigger 3. So basically, we give them the scenario of where they're going and how they're going and what are the issues faced by these people, and then they start discussing the environmental health issue, the social health problem, the communication problem, and things like that. That basically it would allow them to have an idea of what is actually happening in the community and how this community are actually being exposed or need to be exposed, engaged. So these are basically from what we have done previously, and that's where we took our experience from the community posting that we have been through, and also from the community engagement that we do all the time as the Jabatan Kesihatan Awam or Public Health Department. Like in the last week, we went to Orang Asli camp in Rampal, which we are going to use it later as a teaching tool for us to basically engage the student in teaching and engagement sessions. So that's what we do. So what we do in the community, it will be translated into teaching and then into the students' a learning environment. So that's important for us to be able to think of it that what we do as a clinician is not to be a clinician alone, but must be translated into an academic activity or education activity. Of course, we did provide avenue for them to have health communication. So during COVID-19, we have 445 posts basically, and some of them are posts from the students, and we allow the student to actually write articles. So the articles are published on our website, but also their articles are published in a newspaper and sent to newspaper and also news portal. So that the students basically are supervised to write and to communicate health problem, so that to allow the students to basically be able to understand how to communicate with the community in their context. So we have a lot of articles during that period of time, which is basically when we posted it on our SPM website. So the important thing is that because we are in control of the posting and we're in control of the website, and it's easier for us to be able to post news, and these news are basically available not just locally but also internationally, and people do refer to the news and do cite some of our news articles in our website web portal. And then beside COVID-19, we also are asked to do online courses. We are asked to do MOOC course. If you all remember that all of us are asked to create MOOC courses or ODL or whatever you call it, and we are asked to post in the online, post it as the in future learn. So I mean, this is part of the requirement that we need to do. But how can we make it more win-win situation where basically we would reduce our workload in the context of teaching and learning to our normal classes, and also achieve the KPI of having a online course on the Future Learn platform. So we have much thoughts to it, and then we basically identify one of the course that we are doing, which is the occupational health course. The occupational health course is a 14 weeks course schedule. So under the MQA direct MQA guideline, basically we can actually modify 30% of the course without going through the process, and that's what we did. We have 4 classes. We modify 4 classes to become online classes, and then we continue to teach the traditional classes. So currently we have basically 14 classes in occupational health, And of the 14 classes, 4 classes are delivered through our Future Learn platform, which is basically subscribed by the University of Malaya. So students get to free access to the Future Learn platform, and they basically would go through the course in the Future Learn platform. And that is basically very, 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 very beneficial to not just to the student, but as the student has mentioned that they actually like to learn it through a Future Learn platform because they can actually relearn it again and again. But that's also beneficial to the lecturer per se, because currently for the 14 weeks, 4 weeks we don't have to teach, but it's still counted as our KPI because we are still teaching. That means you don't have to have face-to-face classes by doing online classes, but we are still teaching because we have created the online courses, and that's where it is housed, and it continue to be there. So for 2 a year already, basically we have been teaching online, and basically have benefited the time that we spend for the online courses have ROI, which means that we don't have to teach the 4 weeks class. So it's very interesting. But of course, when you talk about online teaching in the context of a lot of people will be thinking is that we are talking it from the perspective of having recorded lecture. And recorded lecture is good, but recorded lecture is not so engaging, and sometimes become very, very monotonous and prolonged and boring. So for the Future Learn online platform, it's a little bit different from traditional online courses where they have a lot of lecture given by face-to-face, but it's more towards written what we call the articles. So basically we create articles, all right. And of course, having articles, just articles itself, without having without being able to talk to them directly, we create animation. So the animation itself, basically this animation is created using PowerPoint, and we translate that into GIF animation. So it allows us to basically communicate and teach in the context of not just teaching them, but giving them animation, allowing to look at how things actually works. And this is very, very beneficial when you talk about new concept or new ideas, which the student have very difficult to actually explain. Even though if you try to explain it in a lecture or try to explain it in an article, it is very difficult. So by having animation to show that how the air flows through the system, how the different air flows and what happened, it allows the student to be able to look at it from the perspective of this. Oh yes, this is laminar flow flowing one way, and where is the problem of contamination and things like that. So we created many different animation to actually assist us in communicating information to the student in the context of this animation. And that is basically look at it from where should you stand in a spray booth to actually get the best outcome. And of course, we have also looking at it from a safety perspective. So we have a lot of different type of animation for different type of ideas, so that to tell the student what's really happening. And that's where this type of things, we spend a little bit time actually creating this animation, but it's, at the end of the day, it's beneficial. It can be used in a much more broader environment. Like we created this animation to highlight how the each of the respirator actually works, and then how it basically air flows within the respirator, and that actually allow the student to be able to look at it and to do both like say the fit testing or fit checking to see whether there's air flows or not. So we don't find this, basically we can find this online, but it is the thing about Future Learn is that you need to have your own IP or your own IP, so that you can actually use them and without needing to reference to other people. So this is what we created for our online lecture. Of course, the idea that the benefit of having online lecture is not just the lecture itself or the article itself, but also the benefit is basically having a quiz. So at the end of few lesson, there will be quiz, and the quiz is basically these are for continuous assess. These are not continuous assessment. These are not assess. These are quiz to make sure that the student actually understand what they're reading, and they have to do it until they get the correct answer, so that they can actually continue to the next section, so that they basically will be able to know that they have read and they have understand the correct thing. So this is always beneficial, because this allows students to read again if they have the concept wrong, have the idea wrong. And of course, then after that, they have at the end of the day, they have an end of course test. They also have what we call hybrid instruction. This hybrid instruction was created many years ago. Yes, that's one of the things that I faced, because I was supposed to teach EndNote, and I don't have the I have a clash in the classes to do EndNote. So from my perspective, how can we actually teach EndNote without having classes? So we created a hybrid instruction. Basically, we created this brief guide to using EndNote. This brief guide using EndNote is very interesting in the context that it is basically have what we call articles or notes, but also it comes with video. So the articles actually like previewing, annotate a PDF document, and that you basically can read and it can teach you how to do it. But if you want to actually to learn, basically it comes in a video, and actually you can actually play the video, and basically a very powerful software. So it will show you exactly how to do the annotation. Which is the same like having in the class session. So it allows you to actually learn from both reading. If you don't understand, then just click on the video, and the video will play. So this document is actually available, and we have been using it for many years to continue to teach. We also created what we call gamification in education. All right. So I think this is basically we use H5P to do gamification. Some of you might have saw this before, but we can actually show you this one. This is the gamification. So we do the case in mercury poisoning, and basically we have some questions, and that the students need to read. After that, they can actually answer what is the element. If they answer correctly, then they would be given the correct answer. If they answer wrongly, then they can redo the answer again. And this is basically some sort of gamification, but not the kind of game that we would prefer. Which basically we play interactive game, but this is less of interactive game, but still the gamification in the context of learning and teaching and learning process. So it needs to be basically the student actually progress from there. This is the gamification using H5P in the context, right? So of course we also have online learning platform. So we particularly before the COVID-19, when the COVID-19 hits, basically we developed an online learning environment with the basic elements that we can get. We actually got a second-hand TV, and then we just have a camera and the radio. Then basically what we did is basically we have two screens, so that the student can see the lecturer, and the lecturer can see the student. So this allowed a very interactive online learning platform in the context that the student is not the lecturer is not looking at the physical student, but not the online student. Of course, then we further develop our learning center. So this is our learning center. Is part of the TDR WHO RTC WHO TDR RTC learning environment that we develop, which we have the video recording, we have the hybrid learning, we have the hybrid classes. We can actually do hybrid class, and we have cameras and video and things like that. All right. That's the end. And the lesson that we learned during this period is basically that you need to always look at new technology and try to see how the new technology and can actually help you in your teaching and learning. And by doing that, basically you enhance your classroom, and also you allow the student to have more interaction in the classroom. Now it's open for question and answer. Thank you very much.
Thank you, Prof. Victor. So thank you for the presentation. We actually have already got one question in our Q&A. I would like to invite members who are attending the session, if you have any questions, any issues you would like to clarify, to also keep it going. So Prof. Victor, there are some groups of students who were exposed to the in-person teaching and the online teaching. From their feedback, which platform do they prefer, and is there any reason for that? This by Yu Kwan Chan.
All right, thank you very much. I think this is very interesting. But from the online teaching, basically, we're talking about during COVID-19 and face-to-face teaching after COVID-19. The students basically prefer face-to-face teaching because there's more interaction compared to the online, or basically hybrid teaching. All right. Because hybrid teaching, there is less interaction, and our student is still more like interaction. That's what feedback we get. But for the aspect of the hybrid learning environment, which is the Future Learn that we created, all the students actually have positive feedback, and they would basically prefer to have more of this hybrid learning environment or Future Learn kind of thing, because they can actually learn in their own pace, and basically they learn much better because of the time that we actually spend doing it, and also it's much more what we call a consistent in the context, compared to when you teach, each time you will teach different thing.
Thank you, Prof. Victor, and thank you, Prof. Chan, for the question. Next, we'll go to Prof. Lau. She has asked, do you believe online classes are equally effective as in-person ones?
It is equally effective if it's delivered properly, and basically, which means that the design of the class must be designed for online classes. You cannot just translate your face-to-face class to an online class. That's what is the problem with it. That's why the Future Learn, which we took a lot of time to actually develop, because we spend time to look at how people actually learn and what people actually want, and that basically have benefited from that perspective.
Thank you, Prof. Victor, and thank you, Prof. Yiling, for the question. Next, we go to Prof. Tunku Sarah. Did you incorporate any elements of what you learned after COVID-19?
Basically, what we learned after COVID-19 is hybrid class is here to stay. And that is where we continue to have hybrid class, because student continue to come out with they're having a medical problem, medical issue. That's why we continue to give hybrid classes, and we don't discourage, but it's not but we do encourage students to come to class to actually to have face-to-face lecture.
Thank you, Prof. Victor, for that answer, and thank you, Prof. Tunku Sarah. So if you all still have questions, please continue asking. The Q&A box is still open. In the meantime, let me ask Prof. Victor a very simple question. So we're asking our academics to gain new competencies, right? To basically learn how to change their pedagogical styles. How can our system, meaning help us in transforming the way we teach, rather than just telling us what they want, but helping us along in gaining that, or acquiring that required competency? Thank you.
I think that's a very, very interesting and good question. And our system doesn't actually encourage different type of teaching. They just provide a KPI that you need to achieve, without providing the adequate training. And of course, the adequate training itself also comes back down to the simple context that none of us actually know what we are doing. All right. I mean, none of us are expert. There's no expert around the world that actually knows what they are doing. So all of us are actually having trial and errors, and these trials and errors is where we like to share our what we call our failures, so that people can learn from it. And that's what I'm sharing today about what I did, and maybe we can discuss on whether what I did is right or what I did is wrong. I think that is much more important and interesting. And that will basically encourage people to actually venture into this. But from what I did, basically 4 of my class is actually now online. So if we can actually convince the academic that you spend time, and then after next 2 to 3 years, you would basically have more free time. So that is what the university to do. But the university need to continue to recognize that every year, even though the online course is published last year, is still in the KPI this year. So my online course published last year, which is the Future Learn, is not in my KPI this year. So that actually defeat the purpose of having do work and continue to do work. So university doesn't understand what we do, and they just want us to do things, but they don't provide us with the tools to do it. Of course, we as academic, we are actually very, very bright and to actually learn how to do it ourselves. Thank you.
Thank you, Prof. Victor. Actually, we've got a few more questions now coming on. Keep the questions going. I will go to the second question first because we're talking about how you're doing. How does one ensure all students are keeping up with their attendance of class and covering their course in good time by having hybrid classes? Prof. Chan.
That is very, very, very interesting because we teach postgraduate classes and we don't care whether they actually learn or don't learn, come or don't come, because we say that class attendance is not compulsory. So those that want to come actually are the one that want to learn, and they come to class to learn. So we cannot blame the student if the student don't come to class. We should blame the lecturer for not having an interesting class. If a lecturer have an interesting class and the class is interesting, everybody would come. That's why if you have an 8 o'clock class and your lecturer is very, very interesting, then people would come to class and would listen. If it's not interesting, then what's the point of getting up? I can just read from the internet.
Thanks, Prof. Victor. Now for 2 very brief answers to these next 2 questions. Has the medical education unit taken up the lead to continue this venture? Just a brief answer.
I have not discussed with medical education unit, so I don't know what kind of venture they want to do it.
So thank you for the question. I think that's something that medical education unit has to take up. The next question is about infrastructure. Is an improved internet or Wi-Fi system necessary for the transition to online teaching? Let's start.
Agreed. I think it's yes. No need to ask a question. That is asked and answered.
All right. Excellent. Thank you very much for this brief answers. We keep the time, so it's 1 minute past 9. So I think we will end the session. So thank you, Prof. Victor, for your time, and thank you everyone for attending the session.
Thank you very much. Thank you, everybody, and hope that it's beneficial to all of you. And it is open for discussion. It's not for me to share. Just share.
As said, if you have further questions, Victor is just down the road. Please go catch him.
Thank you.
Thank you. Bye.